everybody. I would just like to, hello. I think we will get started. We only have 45 minutes for this session, so I'd like to welcome you back from your break, and I hope you had a really good chance to connect with some colleagues and view the posters that were available. I'd like to introduce this session. It is Building Trust in Vaccines, Practical Ways to Inoculate Against Misinformation for You and Your Patients. Just a reminder that we will use Slido for any questions, so please use the QR code on your program to get into Slido, and you can submit your questions through that and then upvote for questions. So I'd like to take this opportunity to welcome Ian Rowe, the content strategist at the BC Centre for Disease Control, and Renata Mares, an adaptable and public health consultant with 15 plus years of infectious disease expertise. So please join me in welcoming Ian and Renata.
Thank you very much. It's good to see a good crowd here. So you may have noticed, if not, please try to notice, around the room there's some poster things hanging up. We're going to get you busy about halfway through here, so you're not just sitting down listening to us yammer on all day. There's going to be 6 stations. You can pick one. We'll introduce them to you so you have a sense of what they are and what you want to do. We're also going to leave them up over the lunch hour, so don't feel you need to get to everything all at once. Renata, anything?
Yeah, so thank you everyone for welcoming me, and thank you especially for Ian for inviting me to join today. My name is Renata Mares. I'm an Eastern European settler, a refugee from Romania, and an immigrant from Hungary. And now I reside in a place that's called Guelph, Ontario, which is located on the traditional territories of the Adirondack, Haudenosaunee, and Anishinaabe people. And it is a Treaty 3, 1792 lands of the Mississauga of the Credit.
Yes, and I, like Bonnie, am from the Far East. I'm from a little further east, Newfoundland, home of the traditional and ancestral lands of the Beothuk people. But I've been here for the last 30 years on Coast Salish lands and honored to be here. Okay, so what's going to happen is this is basically Renata's gig. Okay, so she's really done the lion's share of the work here, and I'm a dutiful helper in this. But I'm going to be doing the fun part, which is helping to introduce the interactive bits here. Renata's going to give, and that's in the second half. Renata's going to give kind of an overview of some really cool stuff. I think. I hope you think so as well. And I'm just going to sit over here and chime in if I need to, but I probably won't need to. So, okay.
Perfect. Thanks, Ian. Okay. And I didn't ask about slides. Perfect. So, as Ian mentioned, he's part of the BC CDC group, and for myself, I wear quite a few hats. So I am the founder of Adaptable Folks, which is a consulting company, and I have collaborated with Canvax on building a course, which you'll hear about later. And I also started working with Dr. Arnaud Gagnon, who's the lead researcher in motivational interviewing for vaccine decision-making with parents and the public. And he's also an advisor to a research consortium made up of 6 countries that's called Jitsu Vax. So it stands for Jiu-Jitsu with Vaccine Misinformation, and particularly COVID-19 vaccine misinformation. And so I will be doing some research, starting a PhD later, comparing these 2 approaches. And so the resources that you see around the room are just up-and-coming approaches and interventions that have shown promising results. So please recognize that these are just examples, and there are many, many more out there. Okay, and so when Ian said come to BC, and I was actually here for another conference in November, I always think of my time visiting Atlin, BC. So has anybody been to Atlin, BC before? Yeah, so I was actually living just before the pandemic hit. I was in Whitehorse, and someone said, we're going heli paragliding. So it's a helicopter ride to the top of Atlin Mountain, and then from there we went down tandem. So anyways, every time I hear BC, I was like, yes, I'll come and visit. But this is what I think of. And so the agenda for today is quite simple, but it's filled. So just bear with me, and if you know of other resources, please don't hesitate to share as well while the practices happening later. So we're going to identify barriers of immunization to misinformation and also applicable strategies to counter vaccine misinformation. And for further reading, I particularly selected this issue of WHO's Infodemic Newsflash. The cover, they always use a Wall-E diagram or using AI, but this particular one is a troll. So it's actually an issue that discusses healthcare providers' harassment, experiences with harassment and trolling online, like doxing and things like that. So this issue is highly relevant to any of the providers, healthcare professionals in the room. So how do we cut through the noise? And so what I refer to is the polluted information environment, focusing on vaccines in this case, but obviously all health topics is a goal right now. And so the team at JitsuVax did a study where they created a taxonomy of anti-vaccination arguments from systemic and also AI assessment. And so they sort of taken all the vaccine arguments that can ever be produced during the COVID pandemic time, and they created these characteristical buckets, which they call attitude roots. Okay, so what I want you to do is we're going to do a quick exercise, just show of hands. So rest your eyes over the 11, pick one that's sort of like, yeah, I hear this all the time, and we're going to ask you questions to raise your hand about this. So pick an argument, any argument around vaccines. And here we go. So how do you cut through the noise currently? So when you hear the picked argument that you had in your head, using your most honest and reflexive answers, show of hands if you just state the facts that vaccines work. So show of hands, you hear an anti-vaccine argument and you say, but vaccines work. Okay, and I do it too, right? Like that's my go-to. Now, show of hands if you debunk. You say, you're wrong and here's why you're wrong. Obviously, do it in an empathetic way, okay? And show of hands, and this is something quite novel, but show of hands if you explain the tactics within the argument, and then you still empathize with the legitimate concerns of the patient. So hands up. All right, okay, so you're the converted, and you probably tested this out, so please share your experiences using the approaches that we share today. Okay, so let's... How do I make that play? Could I have a hand in? Thank you. So we're going to do a quick experiment with pre-bunking, and this is called psychological inoculation. So we're going to get inoculated right now. It's not going to hurt. You might laugh. Do I have to click on the... I prepared and prepared. No. Still missed something. It's just a one minute video, but there's 5 of them. So this video and the other 5 has been created by University of Cambridge, Bristol, and in collaboration with Jigsaw. And they've created multiple videos that demonstrate sort of the biases or the tactics that are used within arguments. And so once you watch this video, you will never forget what a scapegoating means or what emotional language means. They're quite funny, and I love watching them and rewatching them, so I probably know this one by heart. But below it, you'll see a paper that was actually published around the benefits and actually demonstrating results in by using pre-bunking messages to counter vaccine misinformation. And so you can visit Inoculation Science. It's a website, and you can watch any of the videos if we can't watch this one today, which I really want to watch. And I'm super grateful for the organizers. Okay. And so the theory behind it, I'll just keep talking. So the theory behind inoculation science is that using an analogy from how actually vaccines work. Okay, so it's psychological inoculation. And so an exposure to a weakened form of misinformation builds immunity against later on coming across misinformation in other forms as well. And so that's... will be the next slide, but I won't touch it yet. It's really worth this video, I promise.
If this ad fails to get enough views...
Yeah, that's the one. Thank you for being so patient. It's worth it. I want you to see what it's like to be inoculated. Psychologically.
I, your humble voice voiceover artist will be fired, and it'll be because of ad skippers like you. How could you? How am I gonna pay for Cujo's next pedicure? Sorry, what I did to you there was take a complex problem, like how hard it is to get people to view ads, and singled out a specific group such as ad skippers as being entirely responsible. This is a common tactic called scapegoating. Wikipedia says it comes from the Bible. Of a pair of goats, one would be ritually sacrificed and the other, the scapegoat, would be released into the wilderness, metaphorically carrying with it people's transgressions and sins. Imagine there's an alien invasion. Some people might be tempted to use scapegoating to avoid being held responsible, but it's unlikely that a single individual, group, or goat is solely to blame. Here's an example of scapegoating from South Park, bigger, longer, and uncut. The children of South Park have started swearing prodigiously. In desperate need of someone or something to blame, the town's parent-teacher association finds a scapegoat.
Times have changed! Our kids are getting worse! They won't obey their parents, they just want to fart and curse! Should we blame the government or blame society?
Or should we blame the images on TV?
No! Blame Canada! Blame Canada! For their beady little eyes and flapping heads so full of lies. Blame Canada! Blame Canada! We need to form a full assault!
So if someone tries to make a complicated problem look simple by placing blame on a single group, they're most likely trying to manipulate you. True labs. Blame is fine when it's fair.
And that's a psychological inoculation. So what did you all think? Is it powerful? Are you going to pick out scapegoating in pretty much everything you do from here on in? I think so. So, like I said, there are multiple other videos that you can watch and you can use with your colleagues, with your patients. It's phenomenal. And so the next slide will be the theory behind it, which is coming up.
If this ad fails to get enough views, I, your humble voiceover artist, will be fired, and it'll be because...
Yes. Okay, so this is the paper and the theory behind it. And it's kind of funny because the video is out of the UK in collaboration with Jigsaw. So it's funny that they use South Park, that blames us, but it still leaves a great impression. So as I mentioned to you, it is an exposure to a weakened form of misinformation that builds immunity against later misinformation. So that's the idea, one part of the pre-bunking process. And so my Christmas reading was Dr. Sander van der Linden's book on Foolproof, where he actually gave me comfort knowing that misinformation at a very basic level impacts all of us. So there's not one of us that's, sort of super... I don't know what the word is, protected against misinformation. So it's like going to the gym. We do have to practice and recognize the different tactics that are used and how they're being implemented. Two very important notes around, before you go chasing misinformation and disinformation is, one is, prevention is always better than cure. Okay, so as with medicine, so with misinformation, it is better to prevent misinformation from spreading at all than to try and debunk it once it has spread. And so I believe that's Bertolli's law that talks about, if it takes this much energy to create misinformation, it takes this much energy to try and debunk it afterwards. And so this is why we need to look upstream and understand, the narratives and the sentiments behind the conversations that are happening. The second important caveat is by Dr. Claire Wardle out of the Brown University Information Futures Lab. She's the co-founder, and she wrote a paper on misunderstanding misinformation. And again, confirming that an obsession with gauging accuracy of individual posts is misguided. To strengthen information ecosystems or environments, We need to focus on the narratives, the sentiments, and why people share what they do. So we're slowly getting into this idea of social cohesion and how do we protect the social cohesion. And we know out of the US CDC, the epidemics of loneliness is being talked about now. So how do we then counter loneliness, get people to stay connected, and keep misinformation at bay, so to speak? And so why should you care about this, right? It's too big to even deal with it. But during the pandemic, we saw that mis and disinformation have pretty severe impacts. And what the WHO referred to is not just mis and disinformation, but the information environment. So your latest fact sheet or your newest manual gets sort of put into the ocean of what they call infodemics. Now, infodemic sounds like it's only for emergencies, but it's actually talking about a health event and the society that's happening post-pandemic as well. And so what is it, right? And so infodemics is an overabundance of information, including mis and disinfo, and it surges during that health event that I mentioned. But we can all agree that it just sort of continues on. And so it is beyond that circulating bad stuff. It is also the good information and information voids. So where research is lagging, how do you continue to build trust with your population, with your community? And those are called info voids. And if you don't put your honest opinion in there, guess what goes into that information void? It's filled with mis and disinformation. So they're quite sticky, they're always around, so we need to build this healthy information environment. And so isolated and vulnerable populations are most affected. And so please just take a picture. These are just definition on what's misinformation, what's disinformation, which actually comes with a very specific negative agenda. But look at number 11, which is synthetic media. And this is where AI is coming into play. And I think the slides will be available as well, but just to recognize that there are various types of mis and disinfo. And so there was a question in the audience that said, well, what can institutions do? Because yes, we build relationships with people, but what do institutions do? So the WHO infodemic team, during the pandemic, they didn't only train 1,500 folks like us. I was trained within the third cohort of the 4, but they also released most of the documents open access. So the textbook on infodemic management in the 21st century and this diagram is open access. So you could literally say the same stuff I'm saying today just by reading the content. And so health system needs to focus on building trust by addressing questions, concerns, and filling those information voids with honest responses. Because yes, there are tools of addressing misinformation that you will test, but it is not fruitful and you have less impact by focusing on that. And as institutions, you have more impact focusing on that as well. And of course, relationships, not to take away from that. And so recognizing sort of the framework of the information ecosystem, the WHO team, again, from the same textbook, talks about how we no longer have sort of our virtual spaces. People live in a physical spaces. People live in a physical and virtual world, and it's very complex and mixed. So providers like us, we might live mostly in the physical realm, but our clients or our public could be living in a mix of these worlds. So our interventions and resources have to address. And going one step further is that these spaces come with different anatomies. So how you interact in a physical world is very different to how you interact in a virtual world. And I believe one of the poster presentations mentioned around famous people, they're called influencers. And once you get them involved, you may not be able to control them. So just be aware of that. They're good partners, but just keep it quite consistent. Anyways, so I want you guys to get up soon, so I don't want to talk too much longer, but the direct impact of mis and disinformation is not just morbidity, mortality. So Dr. Tedros Ghebreyesus actually said misinformation kills. Okay, so we've established that it does come with morbidity and mortality, but most importantly, misunderstanding of health recommendations and the behaviors that you want people to take up. So all the amount of work that you're doing is actually being silenced because it's such a noisy environment. So how do we cut through the noise, right? Addressing mistrust hinders accomplishments from pre-pandemic. It creates stigmas, right? But most importantly, again, it undermines social cohesion. And this is what I want you to focus on when you're thinking, how can we build trust? And of course, there's a huge cost to it. I won't go over this, but it does come with a cost. So just so you know, all the graphics that you see, it was a graphic designer with the WHO who created these specifically for the infodemic team, and he actually lives in Vancouver. His name is Sam Brad. And so most of these graphics you're welcome to use as long as you say WHO Sam Brad. You can use it in your presentation as well, just so you know. But we need to build capacity in using various tools beyond what we already have. So when you see the info, imagine one information is accurate, one is miss, and one outdated recommendation, and then one is disinformation, which is trying to harm. So it's a sea of information that we need to address. And the quote, I really like this quote, and I've used it over and over again, is that the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. And so here we go. We need to spend some time unlearning some things. So how many of you can relate with this image by any chance? You know, health communication 101? Just tell them what to do, right? Nope, that no longer works. And so it's unfortunate because we do have new publications that addresses behavioral and social issues around vaccine uptake. The unfortunate thing is, before the pandemic, it took about 17 years to implement new evidence into practice. And so we need to start connecting the dots. And so guess what? There is a competency framework for that by the WHO infodemic team. And so the WHO trained during the pandemic in 2 years 1,500 of us across 150 countries using nothing but WhatsApp, Zoom calls, and Google Shared Documents. And we had to problem solve and then present to the minister within 2 minutes. It's called a SIMEX, a simulated experience. But these are the competencies. One of them is social listening and insight reports. So understanding your community's narratives and sentiments online and offline, and getting creative with your high quality information. And so we're going to focus on number 3, which is countering misinformation. So there is no general public. So I'm sure I'm talking to the people, the converted, you recognize that people have values that they have things that they care about, and they have values that they believe in. And so this is actually borrowing from social marketing. Okay, so when other sectors are doing really good at marketing their stuff, public health can adapt. And it's social marketing because it's actually rooted philosophically in social good. And so we need to understand what people want to learn, where they want to invest their energies, finding ways to encounter people and to engage with new material, and the trusted communication that's actually tailored, okay? And it's the more attractive choice. But let's move beyond communication, as I just mentioned, and we need to reduce those barriers, right? We need to tailor services to what people value and care about. Building trust is maintained. It's a process. It's not like, okay, we got trust, we don't have to worry about it. It constantly has to be managed and evaluated. And then, of course, getting you to pick the smallest unit of action. And I will ask all of you to take the smallest unit of action from today's presentation. And so this is what mapping the elephant looks like. Or at least that's what I tell my students, is looking at the system and identifying leverage points where you can build trust. So this is, again, Sam Brad's drawing. It's a UNICEF, it's called, now I'm going to forget it. It's a journey to health and immunization using a human-centered design. So systems and human-centered design actually takes your public health programming and works with the community to make it fit their schedule, their lifestyle, etc. And so as clinicians, like myself, I've worked in many of the vaccine clinics. Number 4, 5, and 6 is the clinic side, and we're pretty good at making people comfortable. But how do we deal with 1, 2, and 3? So this is the knowledge, awareness, and benefits of vaccines. How do people get that information, right? The noisy, polluted information environment. What are their intents, right? So Dr. McDonald had the behavioral and social determinants of vaccine uptake with the boxes. So this is just rearranging the boxes in a graphic format. And so preparation and cost of actually getting to the health centers. So I feel like we all know this in this room. It's just putting it into a systems approach that your communication understands, your leadership understands, your financing understands, so you're getting sectors to communicate in building resources. And so vaccine and general health misinformation actually impacts at all levels of society. So you might be familiar with the socio-ecologic model. And so from the individual all the way to society, misinformation is penetrating it in various ways. And so I specifically did dotted lines to recognize that at an individual level, experiencing misinformation will have a ripple effect, and so this is why it impacts social cohesion. And so all of us are down there holding a toolbox full of tools beyond just the traditional hammer. Okay, so we need to stop hammering different problems with the same hammer. We need to have different tools to sort of work with it, and this is what you will test out. Now, I think I'm done. That's all I have.
Thank you, Renata. So that is a hard act to follow, for sure. It's amazing how much you can pack in there. I was like, how are you going to do this in 20 minutes? Like, I can do it. I know I can. Yeah, I kind of get the fun part. So this is where we're going to get you up and moving a little bit. So for the folks, first of all, folks online, don't worry. You don't need to, bring your phone up to your screen. I'm going to give Michael the cue to post a link that's going to have all of these links here, so you can participate as well. So there are seven different interventions in 6 categories here at these levels that Renata mentioned, individual, family, community, etc. And the first two in the individual zone are bad news, which some of you may have heard about. It's really a game to spot common manipulation techniques. iBoost Immunity, which I have a personal bias against because I'm a co-creator of it, so just putting that out there. We have a new tool. It's a quiz-based application. We have lots of stuff on misinformation and all things vaccines. You're in a vaccine for UNICEF when you participate, typically. But we have a new tool, Watch Your Vaccine Misinformation Persona. And you can go through the exercise. It uses fun things like emojis. At the family level, crankyuncle.org. I don't know if you've heard of Cranky Uncle, but it's based on that relative that we all know and love sometimes. You get to learn from the Cranky Uncle, common techniques that he will use, and it's a fun one as well. At the community level, this is a toolkit for healthcare workers, and we have specific instructions. You're going to go to the homepage and the values and beliefs video. It's partway down the page. They're under core something, and watch that video. It's a good one. JitsuVax, I'm going to get Renata to, because she's like the expert on JitsuVax. So
I'm not. The JitsuVax team are the experts. I just really want to get your feedback on the tool that they have on their website. So JitsuVax has created a tool that helps inoculate healthcare providers with those tactics that I talked about, and then be able to empathetically refute those discussions with your clients and with your patients. And so what you're going to do, there are instructions. You're going to use the term autism, and just to see, so in the research in the right side for you, and then there's steps to what you're going to do, but please provide your feedback if you think this is a tool you could use with your patients, okay? So that's our Jitsu.
Great. And at the government level, there's a UNICEF document that a colleague of ours, Angus Thompson, wrote a few years ago, which is excellent. And so in this one, it's a big document, but you're going to go to page 29. It's in there, and it's a pre-bunking exercise, which I think is quite good. And at the society level, this is where kind of art meets science. So it's a series of images. Are they all done by Brad? Is it Brad or Sam?
No, this one is done by Lifeology.
Lifeology, okay.
Cochrane, yeah.
Yeah, so it's kind of these comic book images, and there's a series of them you can go through. I think it's up to 44 that give you tips along the way, and it's quite entertaining. So what we have are you can pick your poison here, which one you want to go to, or you can browse around, but we only have about 10 minutes. And we'd ask you, we've got pens to write down what you like, what you don't like. There's sticky note things there. You're going to go over, use your phone. We all have phones, right? So no excuse. QR codes now, that's the silver lining of the pandemic, I think. QR codes were dead in the water before the pandemic. And now, look, everyone's got a QR code. So that's an easy way to get there. So for the online folks, Michael's going to post a link that has a link to all of these along with the instructions as well. Go.
Yeah. So just as you're playing, I don't want to keep you from lunch, so I do have 3 more slides left, and then you're free to go. Okay, good. Okay, so while you're playing and listening, some of us can do both, I can't. This is a very important slide because it talks about resources. So while I was the WHO Infodemic team, this is a slide straight out of their presentations because it addresses resources and funding. And so the motto goes, do what you can, use what you have. So they talk about whether you have a bicycle, so literally paper and pen, going into the community, asking about what people's questions and concerns are, or whether you have a 4x4 vehicle or a luxury SUV, which we refer to as if you have, shiny dashboards that you can do social listening on and triangulate information offline as well. That's fantastic. So we are not presenting things that you can't actually use today. We're just letting you know that there's different ways and competencies around how you actually go about doing that. And I only have a few minutes. So I absolutely love these images. We started with involve your community, and we're going to end with involve your community. There was a poster presenter talking about grassroots-led communication and support on COVID vaccine, and so decisions are made within your communities. That's how you maintain your trust, okay? So we want to build not just confident citizens that are confident in our vaccines, but we want them to actually demand it. And I know we sit around, we can't just willy-nilly, pick vaccines and approve it, but there is a process for that. But we do want citizens to demand it rather than we having to try to convince them, right? And so very last slide is, again, WHO Infodemic Management Community has their newsflash, highly recommend. You can do the courses and become a buddy of mine, and we can talk infodemics all day long. So all open access, it's called Open WHO, and you can get upskilled. I've also created, so there was a course funded by Gavi, UNICEF, USCDC, and WHO around a comprehensive training on vaccine programming with infodemic management competencies. So I literally was a mentor in that course, and I said, Canada needs one. So I collaborated with CanVax, and they allowed me to actually build a course on building vaccine confidence and demand in an information age. And of course, Ian's team has developed an immunization communication document, which actually implements motivational interviewing as a strategy. And if you have any more questions, you can reach me there. So with all that, I'll let Ian finish.
So I hope you had some fun. And first of all, apologies. The iBoost, I don't know if it worked online, but the QR code didn't. And I think there was a redirect issue, but that's neither here nor there. But I hope there was certainly lots of options here. And I think the big point here is, as I said, these are going to be left up throughout lunch, so you can continue to play or go to another station if you want. But the takeaway is that these things are out there, and the whole learn unlearn thing. These are the kinds of environments you should be aware of, not just for yourself but for your clients, and to let them know what's happening. The big takeaway for me, if there was going to be one that I'd hope you'd take away, would be speak up. So it's really about and I came across a study actually just last week on this from a psychologist that talked about misinformation. They did a study on this, and a really effective strategy is if you hear something, stop it right there. We talk about misinformation spreading node to node, peer to peer. So that not only goes for yourselves, but it goes for your clients. So if you have those clients that you know are really pro-vaccine. And as Shannon mentioned earlier, there's a silver lining of the pandemic is that there are a lot more really pro-vaccine people now out there who can really have a real positive effect. Encourage them to speak up if they hear something that isn't right. It can be at the soccer pitch with the soccer moms. It can be at Friday night having dinner. And so I hope you all are doing that as well. But encourage your clients to do that. That's a practical thing you can do if you're not doing it already. The last thing I'll say is, one of the things that we're trying to do to address this at Immunize BC is we're exploring how to implement misinformation. And it can be misinformation tips, but to address the issue of misinformation on the website. So you're going there as a parent to learn about HPV, if your kid is going to get vaccinated or not. But it's more than just about the vaccine and about the disease. We're also going to provide practical strategies for that parent to watch out for when they leave the website and go out into the virtual world and the physical world that they also inhabit. And it's those kinds of things that we hope to do at an institutional level that can, eventually build up trust, build back trust, whatever you want to say about that. So I think we have 2 or 3 minutes left. We're going to do some questions, if there are any questions.
So, Michelle, are there any questions through Slido?
Yes. So earlier it was discussed about AI and the use of AI. So are there any ways that you're aware of about how we can use AI to combat misinformation, disinformation, or whether such initiatives are taking place?
Yes. The short answer is yes. There's actually an incredible group of, again, cross-sectoral, transdisciplinary folks who are coming together in the regulatory aspect. Countering mis and disinformation with AI will actually increase the infodemic wave. So the question is, do we want to do that? Okay, so this is a really good question, and I don't want to go too much into it, but just remember, any good information that you put in, it goes into the ocean, and so do you want it to just float there, or do you want it to actually create impact? That's one. The other is there's something called, at the social level, All Tech is Human is a grassroots organization, and AI Justice League. So these are advocacy not-for-profit groups that are actually building the culture of how do we have responsible tech, how do we have responsible AI information tools and resources. And I was a mentor with All Tech is Human. They actually created a subgroup of health and wellness. So across the health and social service professions, sectors, where we have individuals sort of transferring from physical worlds to virtual worlds and delivering care and health programming. So look out for the social sort of hive mentality, which reminds me, WHO actually has the Hive. So what they did is create a platform called the Hive where using WHO standards and national standards and grassroots partnerships to actually create solutions that are targeting whatever the country, community, subgroup, jurisdiction needs. So there is something called the Hive, which is, again, feeds off of that. So lots of online collaboration, but offline impact that's sort of happening and gaining traction. So that's a long answer.
Okay, I think we have time for one more question.
So the question is surrounding measles in the context of what we're seeing with measles. So what are some examples of ways that we can combat misinformation related to measles vaccines, applying the learnings from today?
Wow, yeah. I think in addition to all the things that we normally do, we need to keep doing those things. Like I had a request yesterday. We had measles posters in 2019, and we decided to discontinue them this year. That was a mistake. So guess what? We're going to revise them and update them. I think this is an ever-changing environment. The best advice I could give would really just to be vigilant around it. There's no magic bullet here that I'm aware of. around misinformation and measles. The first thing, though, you need to do is be aware of what's out there. So when your client comes to you and says something, let's say, a little off, then you're not surprised by it. The best thing you can do is prepare. So you'll, these things probably don't deal with measles specifically, or maybe they do. Maybe they're being updated. Being familiar with tools like these that are out in the virtual environment, that's where people are getting their information and their mis and disinformation. So being aware is probably the best thing. Yeah.
One thing to add is, remember the arrow that talked about institutions having more impact or less impact? So answering questions, concerns, and filling information voids. So then I think to myself, right, how do I get to the questions and concerns? Well, one competency addresses social listening and insight reports building. So how I can listen to my community online and offline is by going to the US CDC website, and there's actually something called a rapid community assessment. Within 2 weeks, you can understand the narratives and sentiments of your community around measles, and then you can create messaging that actually targets those issues. So that's just sort of giving you like how you can find information, would be mine.
Okay, so sorry we've gone a little bit of overtime, but thank you, Renata and Ian. That was an excellent, excellent presentation, so please join me in thanking them. So just a little housekeeping. We're stopping for lunch now, and for the virtual audience, the live stream will start again at 12:45 p.m. BC time. And for those of you who are here, lunch is set up in C440, just out there, and beverages can be found in the foyer. And please visit the posters in the hallway during your break, and please return back here at 12:45. Thank you so much.